Good afternoon. I am Sarah Crawford. I represent House District 66 here in Wake County. I'm joined by my colleagues today from the House Democratic Caucus because healthcare affordability is one of the central cost of living issues in this state. You have heard from our caucus already on the affordability of housing, electricity, and food, all of which are essential to survival. Healthcare is no different, and in many cases, it can be even more daunting because healthcare costs are enormous expenses that often come unexpectedly and are difficult to budget. When a parent cannot afford treatment for their children, when a senior cannot afford long-term care, when a worker skips a necessary doctor's visit because they have no insurance or the bills are just too high, we cannot and should not avert our eyes from the fundamental fact that this is not a functioning system. Many developed countries seem to have figured out affordable health care. But here in North Carolina, it is treated as if it were a luxury good. But it's not. It is as essential to life as food or housing. House Democrats are putting forward today a healthcare affordability and access agenda because North Carolinians deserve more than empty promises. They deserve a plan that lowers costs, increases access, and supports our older adults. I'm going to begin today with Medicaid, because Medicaid is the essential avenue to health care for 1 in 4 North Carolinians, 3 million people here in our state. For many, it is the only way that their children can see a doctor. It is how people with disabilities receive health care, and I know that firsthand as CEO at Tammy Lynn Center for Developmental Disabilities. And it is how many rural communities maintain their community hospital. Our proposal provides the funding necessary to adjust the Medicaid program for changes in enrollment, service costs, federal match rates, and the Children and Family Specialty Plan. It also eliminates the statutory triggers that could discontinue coverage for the Medicaid expansion population if the state funding model changes. Families should not have to live under a cloud of uncertainty about whether their health care coverage will still be there. When we're talking about people's essential health care, that health care should not be contingent on technicalities. For families navigating autism services and other intense behavioral health needs, we must ensure that we are delivering quality, accountable, and accessible care. While conversations around autism services will continue in the legislature, our bill allows DHHS and managed care organizations to operate closed provider networks for research-based behavioral health treatment, also known as ABA, in a way that preserves access to quality, responsible, and accountable treatment. Our healthcare agenda is built around the belief that healthcare should be affordable, accessible, and reliable. This essential care must be protected. Markets must be more competitive, and seniors must be able to age in place and be given the dignity they deserve. Healthcare workers must be paid enough to stay in their field. Mothers and families must receive support before, during, and after their pregnancy. That is the agenda that we are outlining today. It is practical, it is targeted, and it is rooted in the real experiences of North Carolinians.